Good day. This is the COVID-19 update, and of course, I have with me the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's a pleasure having you here with me.
Well, thank you once again for having me on this program.
All right. The Christmas weekend is almost over, and we're turning our attention to the new year 2021. The COVID-19 vaccines have reached Latin America. Is this the best gift for 2021?
Well, I think most people would agree that it is a very good gift if they can get it. Unfortunately, a lot of the vaccines would not meet all of the persons who would require it in 2021. We are part of a mechanism called COVAX. COVAX intends to produce about 2 billion vaccines and make it available, but there will still be a lot of people who would not be reached in 2021. But a vaccine is a good thing because the vaccines that have gone through phase 3 clinical trials and are now given emergency use authorization have shown that they have high efficacy at about 90 in some cases, 95% in others, and that's a good thing. And if we are going to exit the pandemic, it would require all of us to be immunized so that the population can develop some levels of herd immunity. So yes, indeed, a vaccine would be a good thing to have in 2021.
And can you make it categorically clear that acquiring vaccines for Guyanese in 2021 is government's top priority?
It is our top priority because we have been working very closely with COVAX, and COVAX has agreed that we're going to get the first tranche of 3% of our population, vaccines for 3% of our population. That would, of course, go, first of all, to the frontline health workers. And then after that 3% tranche, we will then get another 17% or so over 2021. So we are very happy to work through this COVAX mechanism. And Guyana is part of a subgroup of COVAX called COVAX AMC 92 countries, where we would be getting our vaccines free of cost.
Also, Minister, the IDB is raising some US $1 billion to acquire and administer the COVID-19 vaccine in the region. And does this help to ease the fears about the eventual availability of the COVID-19 vaccine in the region? And also, you would have previously called for fair distribution of the vaccines.
Yeah. So the thing here is that while 92 countries in the world would be able to access free vaccines through COVAX, all the other countries have to pay for their vaccines, at least the first 20%. And they have to get these resources from somewhere to be able to do that. In the Americas, the Inter-American Development Bank has been working with governments across the region, and they have developed a special portfolio within the bank that if any country requires money to pay for vaccines, that those monies would be made available. The bank has also put together a special team of persons within the bank that would assist countries to fast-track the agreements and all the negotiations and so forth, so that these monies can be available in a timely manner. Similarly, the World Bank has extended a similar arrangement to countries, and if countries are desirous of borrowing from the World Bank to buy vaccines, then those facilities are available to countries. So this is something that the financial institutions recognize, that they ought to provide emergency financing so that countries who don't have the money right now can be able to borrow it and be able to pay for these vaccines. The challenge right now is not so much the availability of money, The challenge is really the availability of vaccines. And that's where COVAX comes in, because while in the US and Canada and UK and Europe, a lot of attention has been paid to the mRNA vaccines from Pfizer and Moderna, many countries outside of this grouping, the developed world, would not have access to these vaccines, at least for a short period of time, because the vaccines have all been paid for, bought by these top countries, and therefore they would have to give them first.
Yes.
After they have supplied them, then they can turn their attention to other countries. So there have been a lot of discussion about the inequality of not being able to access vaccines. And COVAX was really created as a mechanism whereby all countries in the world can have access to vaccines. And they have spent a lot of time negotiating with manufacturers, negotiating with distributors, so that they can get the best prices, because they're buying for so many countries and they're buying in bulk, that they can get the best prices. And of course, be able to test these vaccines, make sure they work properly before it's given to the various countries' population. So COVAX has really been a standout in this regard, assisting many countries around the world to get access to vaccine. If you didn't have a mechanism such as COVAX, it would have been very challenging for small, poor countries to have access to vaccines.
Minister, I know you just mentioned that the issue is not necessarily about the availability of money, but the availability of vaccines.
Yeah.
Nevertheless, Guyana has received an additional $30.4 US million as part of a continued COVID-19 crisis response loan. How important is this for poor countries in general in gaining access to the vaccines?
Well, outside of vaccines, one is that now that vaccines are becoming available, we'll have to buy them. And it's not just about vaccines. When you get vaccines, you have to store them somewhere. So you have to get the freezers, you have to get the cold chain. Moving a vaccine from point A to point B requires a cold chain. And then, of course, in terms of being able to immunize someone, you will have to train people, and there's a whole series of things that you have to do. The vaccine rollout in any country is going to be different, because we are going to immunize more people. In Guyana's case, we are accustomed to immunizing children.
Yes.
And our birth cohort in Guyana is probably between 15 to maybe 12,000 children per year. What we are talking about here for us to roll out a COVID-19 vaccine is that we have to cover maybe between 70 to 80% of our adult population, or even higher. And that's far more than just 12 to 15,000 people. And then we have to do this twice, because the vaccines that are available, you have to get a first dose, and then in some cases 3 weeks after or 4 weeks after, you have to get a second dose. So it is important that we prepared for that, and therefore we'll need some monies up front to ready our system, and hence some of the monies that we have received from these institutions are going into that type of preparation. In addition to this, while we are waiting a vaccine, people have to protect themselves. And you would know that in protecting your health workforce, you would require to have personal protection equipment. These are disposable things, so masks, whether they are N95 or surgical or procedural masks, this is what is utilized in the health system. You will have to get hair covers, you'll have to get gowns, face shields, shoe covers, and so forth. And you use them 1 day, 2 days, you throw them away. You have to dispose of them, right? And depending on where you're working in the hospital, if you're working in a COVID ward, when you come out of that ward, they generally discard the PPEs and then they go. If they have to return back to check a patient, they have to put on new PPEs. So it's you have to buy a lot of supplies and make it available, and it's a very costly thing to have. Because as you can imagine, every country in the world is trying to get their hands on PPEs for their own population of healthcare workers. So this has been a major cost for us. Then another cost area has been to have all the equipment and supplies. One of the big things that we have been working on and we have now been able to have a fair amount of is ventilators. So here again, these things cost a lot of money, and we have been ensuring that we have these things in place. Medicines are another area that costs a lot of money. So if you want, for those patients with COVID that are hospitalized, you have to buy some of the medicines that would be required in an ICU, things like remdesivir and so forth, and those are very costly medication. So, but nevertheless, we have been buying these things, and therefore the sums of money that you have just mentioned is going to help us to be able to do that. And we are very grateful for this type of partnership with the IDB, the World Bank. We have been able to negotiate some of these things in record time. IDB and World Bank loans take a long time to do. We have been able to do this literally in weeks. And their board also have been meeting very regularly, and they have approved this in a very timely manner. Outside of the monies that we have received through these two financial institutions, we have also been working with other bilateral partners. We have received assistance from India. We have been working with Qatar, and we expect to get some assistance from Qatar. We have been working with Brazil, and we expect again to get some assistance from Brazil. So there are a number of countries who have offered us help during this pandemic, and we are very thankful and grateful for all the assistance that has been given to us.
Minister, you spoke about the immunization of adults. Of course, we'll need to have a legislation, or rather the amendment of a legislation to cover adults. How soon can we have that tabled in the National Assembly?
We have a draft that has been prepared, and we're thinking about doing a new piece of legislation, because the existing legislation dealing with immunization is about immunization of children. And we thought that it's important enough for us to do a special piece of legislation that deals with COVID-19. So we have a draft that has been prepared, and we'll be tabling that very shortly in the National Assembly. As I signaled in the motion that was recently passed, that we would be bringing this new piece of legislation early in the new year.
Thank you, Minister. Also, a recent study published in a medical journal found that the materials used for making masks do not prevent the spread of the coronavirus. Could you explain the different types of masks used, and also how does it protect oneself and others when worn?
Well, the rationale behind wearing masks is a simple one. For someone to get infected with coronaviruses, it's either through a droplet or through aerosols. And you would be able to acquire those droplets if you breathe them in, right, or aerosols. So this is the more popular way of getting infected. And if you wear a mask, then you prevent droplets from getting to your mouth or to your nose, and therefore you would not be breathing in these viral particles. Now the other way, so that's by breathing. Now the other way is that you can walk into a room and the surfaces are contaminated because maybe somebody sneezed in that room and the droplets fell on a table or something and you touch it, and then you put your hands to your nose or your mouth and you can get infected. A lot of us, when we're going through doors, we tend to hold the knobs, and those knobs, if you have a contaminated surface there, you can pick up the virus from there. So that's another way in which transmission can occur. So if the main way of transmission occurring is through the airways, then if you protect the airways, then you break that level of transmission. Masks have been shown and proven to be effective in preventing that type of transmission, whether through aerosols or through droplets, right? Now, there are different types of masks, and depending on the risk that the person faces, these different types of masks are recommended. So just covering your face with a piece of cloth can prevent you from getting infection. So they'll prevent droplets from getting to your nose or your mouth. And we have been talking to persons across this country to at least use a face mask made of cloth. If you construct that face mask using several layers, then it can protect you, especially from these droplets. The second one, then, is to use a face mask that is specially built for the purpose. So those you have things like what is called a procedural mask that is used in a medical setting, or a surgical mask. These masks have several layers, and they're able to reduce the spread of infection because they're able to filter out very small particles, right? And so in the case of a surgical mask, its efficiency at filtering out viral particles is up to about 95%. N95 masks are what you might consider the premium type of masks that are available. And while they're called N95 because they're supposed to filter out at least 95% of viral particles or very small particles, some of these masks are so high performance types of masks that they're able to filter out as much as 98% of viral particles. And that is why they're used primarily in a healthcare setting, especially in places or in enclosed environments where you might have a COVID-19 patient. So in a ward of a hospital, in an ICU, the doctors and nurses would normally wear N95 masks or a surgical mask because they have these very high levels of efficiency in preventing viral particles from getting in. And so there you have it. You have different types of masks, and depending on a person's risk, right? If you're going into a ward with a COVID-19 patients, then you want to have the best type of mask. And that's what we've been providing for doctors. There are some other types of things which we have not used much of here, and these are called respirators. So you wear them over your nose. Some of them have an attachment with an oxygen tank, but we don't need those now. At the beginning of the pandemic, when people did not understand much about the virus, people were being ultra cautious and they were using these types of equipment. Now you use them less and less because we have a better understanding of the dynamics of the transmission of coronaviruses.
Dr. Anthony, we're still in the holiday season with New Year's coming up this weekend. Could you reiterate the need for social distancing?
Well, I've been repeating this ad nauseum, so I guess by now everybody should know about that. But just in case people still don't get the concept, the reason why you want to stay at least 6 feet away from the other person is that if you cough, right? If you cough, these droplets tend to travel for about 6 feet and then fall to the ground. So if you're closer than that, then the possibility that the droplets can get to you, right? So imagine the person does not have on a mask and the other person does not have a mask. And the person who coughs is a COVID positive patient. So when he coughs, he's coughing out viral particles, and the other person, because they're unprotected, what would happen? They'll breathe in those particles, and then they'll get infected. So we can prevent this by staying at least 6 feet away from each other, and secondly, by using masks. So even if you're 6 feet away and you have on a mask, and somebody coughs, the chances are, even if you got some stray particles, that it still would not affect you because you're able to protect yourself, right? So it is important that, you know, in the holiday season or even beyond the holiday season, that people continue to do the 3 W's. 1, wear a mask. 2, watch your distance. And 3, wash your hands. And if we do these 3 simple things, we are going to prevent infections from occurring.
Minister, in many parts of the world, the amount of persons infected with the disease continues to rise. In Guyana, the cases has dipped to just around the 400. Does this mean that since assuming office, you would have, by large, keep the amount of persons infected with the COVID-19 under control?
I don't want us to use those numbers because when people see a little bit of decline, they get complacent. We're not out of this pandemic as yet. For us to be out of this pandemic, it means that we have to get people immunized, and that would start happening from sometime next year. So until then, we all have to be vigilant. These numbers can change tomorrow because if people become complacent and don't practice the right things, then they're going to get infected, right? So we have to ensure, and we have to keep repeating this message over and over for people to protect themselves. The numbers would change every day. Some would go up, some would go down. We're happy that we have seen a trend coming down, but that can change overnight because of people's behavior. So I don't want us to pay too much attention to that. What we need to focus on is the preventative aspects of this. And each person in this country can do their part by making sure that they adopt the right attitude and the right types of behaviors. If we do that, we are going to make a tremendous difference to the dynamics of this epidemic and the outcome.
Thank you, Minister. Are there any other areas attracting attention by the HEOC and surveillance at the moment, as were Linden and Maracaibo recently?
We continue to see in various parts of the country, maybe a little spike here and there. And as we notice them, because we have every day, we have our surveillance team that would look at the numbers, look at the cases, what is happening in which part of the country and so forth. And we'll monitor. And if necessary, we go in, we do contact tracing, we find other people, we test them. So this has been the ongoing effort at the ministry, and we'll advise people how to contain. We have been doing that. We have had our own little success stories here and there. A good example has been with St. Cuthbert's, where you had at one point 200 and something cases. Now that community almost has 0 cases. We have had similar things in other communities. Quibana, for example, same approach. And in Region 9, at one time you had a high spike, and we have been able to contain it. But these efforts would have to be ongoing, right? Until we are able to immunize people. And until then, everybody got to take the precautions. And that's what we keep saying to people. Unfortunately, I guess people are fatigued and people don't want to use masks and so forth. But if you don't, some people are going to get sick and they're going to get a mild or moderate form of the disease, which does not require hospitalization. But there are 20% of the persons who are going to be infected who would require hospital care. And about 4% of those would require ICU care. And that's not a pretty place to be, right? So people need to understand, you don't know whether you will end up in the ICU or not. And the better thing to do is to prevent this from happening. And those persons who have an underlying medical condition like diabetes, hypertension, heart disease, and so forth, they are at high risk, and therefore they must be extra cautious. They must take more precaution than other people. Those people who are older need to take additional precautions, because we have seen more cases of older people getting ill, and among older people who get the disease, that a higher percentage of them would die. And therefore, if you want to protect the elderly in your home or in your community, then you have to ensure that they do the right thing, and that not the young people in the house go out and party and then they bring back the virus and give it to the old people in the house. So people gotta have that sense of responsibility, and it's an important thing.
Minister, a new strain of the disease has been found. What does this mean for the vaccines that were created for the initial disease, and also for the persons anticipating the vaccines in Guyana?
Well, viruses mutate all the time. The mere fact, their life cycle, they'll have mutations. Whether those mutations are significant enough to change the strain of the virus to make it more virulent or make it weaker, you have to observe them genetically and then to see the outcome clinically. In the case of the most recent strain that has been talked about, and that's the strain from the UK, there are about 23 different types of mutation that they have seen in this particular virus. And some of them, about 7 I think, are mutations on the spike protein. But so far, the experts believe that this is not going to change any outcome with the effectiveness of the vaccine. And we'll continue to monitor. The experts who are looking at the genetic makeup of these new strains have been monitoring it, and they're trying to see what other characteristic. Is this thing going to be more transmissible? In the case of the UK variant, they're saying yes, that it can increase transmission, meaning it's faster to get. Is it going to be a strain that would cause more people to get sick or sicker? They have seen a particular mutation that they're worried about. They don't know how that is going to translate in the next week or so. So again, these viruses, they mutate, and you will have new strains. And yes, you can be infected with one strain and reinfected with another, because they are examples of reinfection. So again, people need to understand this. It's something that we are all learning about, but the scientists and those people who have been tracking the virus and looking at its characteristics and so forth have done a pretty good job at getting us to understand the science behind all of this, and have been sharing that information with the rest of the world. So we are very grateful to get this type of information and to see, how this virus is evolving.
Minister, is there anything else you would like to add?
No, I think that's good enough.
Well, thank you for being here. It's a pleasure, of course, interviewing you. This has been the COVID-19 report. You can visit dpi.gov.gy for more information. Goodbye for now.